An 11-year-old has been the first NHS patient to get a treatment how uses the flesh's own cells to struggle carcinoma. Yuvan Thakur, who has a shape of leukemia, was taking into account the personalised treat at Large Ormond Road Clinic, in London, following usual carcinoma treatments unsuccessful. Vehicle T involves removal immunity cells and changing them in a lab so they can recognize carcinoma cells. Previous, it was accessible just as portion of a clinic study test. The Vehicle T treatment, named Kymriah, expenses £280 to £1,000 per patient, but the NHS has agreed a unsolved reduced cost in the producer, Novartis. Kymriah is licensed to consider patients up to 25-year-old in C-cell severe lymphoblastic leukemia, ALL, for whom some treatments include unsuccessful. NHS England announced in September how it would be financing the treat, rather than 10 days following it was given a Europe license. Yuvan, of Watford, was undiagnosed in leukemia in 2014. He acquired chemo and later underwent a ivory squash replant but relapsed following both of treatments. Yuvan's parents, Sapna and Vinay, told, while Yuvan was undiagnosed, it was the largest harrowing news story we had always acquired. We tested to remain encouraging, as they say leukemia in family has 90% treatment bet, but sorrowfully his disease relapsed. The new treatment is our recent expect. Yuvan told, I very expect I get superior quickly so I can trip Lego building in Denmark. I loving Lego and am house a big pattern Bugatti time I'm in clinic. Severe lymphoblastic leukemia affects on 600 human beings a year, generally family. Largest are healed by usual treatments but on 10% recurrence. In November, it was announced how in King Manchester Families Clinic and Newcastle-on-Secret Hospital's NHS basis confidence, would consider family in the uncommon shape of leukemia. Up to 30 patients a year are anticipated to be purified. Vehicle T is a really personalized shape of carcinoma treat. At first, the patient has bloodstream remote and the white's bloodstream cells are separate in the otherwise of the bloodstream creature refundable to the patient. The T cells, a specific kind of immunity cage, are later shipped to a lab in the joint state, wherever a innocuous viral infection is utilized to paste genes in them. These genes reason the T cells to add a crochet onto their shallow, named as a chimeral antigen receptor, vehicle. These designed vehicle T cells, programs to recognize and kill the patient's carcinoma cells, are increased in enormous numbers and later infused behind in the patient. Tuva had his immunity cells remote in November and the designed T cells were infused recent 1 week. Dr. Sarah Garashian, advisor in pediatric hematology at and Yuvan's physician, told, we are so happy to be capable to propose patients love Yuvan's opportunity to be healed. Time it will be a time up. The result of the strong new treatment is named. The treat has shown really promise results in clinic testing and we are encouraging how it will assist. King Manchester Families Clinic has as well started treat their at first patient in the personalised Kymriah immune therapy. The 11-year-old lady, of Liverpool, is anticipated to include her updated vehicle T cells infused in a few weeks. The can reason dengue, low bloodstream blood pressure and challenge respiratory but can be purified in largest patients. NHS England has as well coordinated to Foundation L's vehicle T treatment for adults in lymphomas. The treat, Yescarta, would include price almost £300,000 per patient but Gilead Sciences has coordinated a reduced cost. Up to 200 patients a year will be acceptable.